All right. Thank you all. Dr. Ashraf, thank you very much for being here. Thank you all very much for joining us for this press briefing on what the state is doing to slow the spread of coronavirus here in Nebraska. As always, we're going to put that up now. Thank you, Taylor. As always, we want to remind people about our social distancing rules, right? When you're out in public, keep that 6 foot of distance between you and other people. Wear a mask when you go to the store. Wash your hands often. Avoid large groups of people. These are all the types of things that will help us continue to slow the spread of virus here in Nebraska. We've been very successful here in our state in doing that. Our benchmark has been our hospitalization capacity. How much room can we have to be able to offer someone that hospital bed, that ICU bed, or that ventilator when they need it? And we've been able to maintain that through this entire pandemic. In fact, as of today, right now, our hospital capacity is at 43%. Our ICU capacity is actually up at 53%, and our ventilator capacity is at 76%. So you can see we've got robust hospital capacity in the state today to be able to take care of people. And that's what we're focused on. So please, even as we talk about going through the summer and loosening restrictions, remember to practice our social distancing guidelines. Next, Test Nebraska, another important aspect. We will be this week in Chadron, Alliance, Scottsbluff, Sidney, Burwell, Kearney, Norfolk, O'Neill, Valentine, Columbus, York, Lincoln, Falls City, Bellevue, and Omaha. So if you're in one of those locations and you have not signed up yet, I believe we're about 170,000 or 73,000 people have signed up. But if you're in one of those cities I just talked about and you have not signed up, we have opened it up in just about all those cities, except within Douglas County, to be able to get tested. So if you have an interest, sign up. You will be able to be available then to be able to get a scheduled time to come in and get tested. So go look for that scheduling slot if you're in one of those cities. That'll be going on. In Omaha, we're still prioritizing 15 to 35-year-olds, but we will be looking at broadening that as well down the road. So please stay tuned for that. Well, one of the things that we have been trying to do, and we have not gotten it done yet, but we're going to get it done today, and this is why I was so excited when I walked in here earlier, is that we always proclaim June Dairy Month here in the state of Nebraska. So I'm very excited to do that once again, proclaim June Dairy Month here in Nebraska. We've got 127 dairy farms here in the state of Nebraska. They are 100% family-owned, and they produce a high-quality, nutritious product that's a part of a great, nutritious diet. And our statistics are actually a little bit higher than the rest of the country nationally. About 95% of all dairy farms are family-owned. So I'm very excited to be able to sign this proclamation proclaiming June as Dairy Month here in the state of Nebraska. And to talk a little bit more about that and to receive the proclamation, I've got Mike Gunther, who is the president of the Nebraska State Dairy Association. So Mike, do you want to come up here and join us and please accept this proclamation? There you go. You get a picture from Taylor. Where is he? Come on, Taylor. All right, great. Thanks, Mike.
Thank you, Governor Ricketts, and thank you for all your support and leadership through the dairy industry. Again, I'm just one of the dairy farmers here in Nebraska, and I just want to kind of highlight on a few things from the dairy industry. I'll call them the past, the present, and the future. So for the past, a lot of you already know, the products that we create, but just so you know that they are continually getting safer all the time. They're very nutritious. We're always, with research and everything too, just continue learning how healthy the dairy products are. And even some people might have worried about the fat in the past, and we continue to learn that's actually a pretty healthy component to milk and milk products. And then the innovation, right? So you all know with ice cream and milk and yogurt and cheese and butter, we can name so many dairy products. They're continuing to grow, and different products of yogurt, different products of milk, as in A2 milk, as in lactose free. So just continue to the excitement of seeing the new stuff that we come up with. The present, so going through COVID, as dairy farmers, we were considered an essential business because of, two fronts. One, we had cow care to always take. We always had to be there to tend to animals to make sure that they had the quality of life. And then also that our job is to feed the state, the country, and the world. And so we're always there to continue to produce the milk and that product. Also during that time, we've worked with the Midwest Dairy Association, producing coolers and a lot of dairy products for the food banks and food pantries. And continue to try to reach out to those people that maybe aren't getting maybe the milk or the food that they need at this time. And then on the future, dairies are very self-sustaining, but we have made a goal by 2050 to have a neutral carbon footprint, or even better. So though we are self-sustaining, we're always going to try to get better and continue to do our part in the environment. So thank you. Now for the toast, I believe.
Yes, so let's go ahead and after you, Mike. Don't take the chocolate one, though, that's mine.
I got the chocolate.
All right, so we're gonna do our dairy toast here. Cheers.
Cheers.
We're actually not gonna touch because, the whole coronavirus thing. All right, cheers. And that is one of my favorite parts about Dairy Month, getting my chocolate milk. Thanks very much,
Thank
Mike,
you.
appreciate it. Thanks for you and all the dairy farmers. Oh, Mike, don't forget your proclamation.
Yep, that's going to go on my bedroom wall probably.
Sure it is, Mike, sure it is. All right, next. We're going to talk about the changes we're making to the directed health measures. We are announcing today, well, let me take a step back. We put in these restrictions back in March to be able to slow the spread of virus here in Nebraska, and it's been very successful. We've been taking a step-by-step approach to loosen the restrictions to allow people to go back to a more normal life while still making sure that we're taking steps to slow the spread of the virus here. We started loosening restrictions May 4th. We made a variety of steps in May. June 1st, we announced some restrictions being loosened, and we're announcing more restrictions being loosened today. So May 4th was really kind of going into phase 1. June 1st is going into phase 2. Today we're announcing phase 3. So phase 3 will start with all these 89 counties that are in phase 2 right now. We're going to be going to phase 3, and then the Central District Public Health and Dakota County, those that are in phase 1 right now, they will be moving to phase 2 on June 22nd. So again, most of the state is taking another step forward into phase 3. Our 2 other public health districts are taking a step forward going into phase 2. So then that's Hall, Merrick, Hamilton, and Dakota County will be in phase 2. So we have some of those changes are going to be statewide. So for example, statewide changes will include sports, fan attendance for youth and school games changes to the same limit as gatherings on June 22nd. So we have a category for gatherings. Those sports venues or those sports gatherings will be included in that. It'll no longer, for example, be limited to just household members. I know this is one of the things that a lot of people contacted our office about. For example, grandparents being able to go to a Little League baseball game. Starting on June 22nd, that will open up and it'll just be covered under the gatherings section of our directed health measures. Another item that will be pulled out of the directed health measures completely will be elective surgeries. Elective surgeries, you may recall we originally had the 30-30-30 rule, 30% hospital beds, 30% ICU ventilators, that sort of thing, and then 2 weeks worth of PPE. We took that down to 15%. Now we're taking those restrictions off entirely and expecting hospitals to manage it to make sure that they can serve their customers and still be able to accommodate coronavirus patients as needed. And as you can see from what we talked about earlier with regard to our hospital capacity, we've got lots of capacity. All right, starting June 22nd, the following guidelines apply to all counties except for those 4 that I mentioned before. The ones that are still in green there, the Hall, Hamilton, Merrick, and Dakota will still be on phase 2. But for everybody else, starting June 22nd, the following guidelines will be in place. So bars and restaurants, bottle clubs, gentlemen's clubs, and so forth will remain open for dine-in. Patrons will be required to be seated at tables while on premises unless they're getting up to place an order, use the restroom, or one of the new things in this phase is we're going to allow games. So arcade games, pool, darts, you got it, that kind of stuff will be allowed now under the DHM. However, you still have to have a seat in the dining room. You still have to have a seat to go to be able to play those games. Occupancy will be 100% of rated occupancy. However, they will still have to have a maximum of 8 people at a table. That's up from 6. Food may be consumed at the bar. That's a new change. Self-serve buffets and salad bars are still going to be prohibited. Staff will still have to provide serve the food directly to all individuals. And then the rest will, the 6-foot distance and so forth will be in the guidance. So that's what's going to be with regard to bars and restaurants. Again, loosening those restrictions, another step but still having guidance and restrictions with regard to how that's being done, but 100% capacity there. With regard to child care facilities, capacity will be limited to the following numbers. Infants to 3 years old, 15 children per room. 3-year-olds to 3-year-olds will be 20 children per room. 4 to 5-year-olds will be 24 children per room. And Felicia, I believe that's just the licensing guidelines that is already established in HHS. Is that right? That is correct. Felicia's nodding her head, yes. And then school-aged children, K through 12, 30 children per space will be the child care guidelines. That is different from the typical licensing that we have, but that'll be what child care will be able to go to starting June 22nd. All other state provisions, statutes, regulations, including child to staff ratios, will still apply just like regular regulations. Gatherings. All right, indoor gatherings are now going up to 50% of rated occupancy. It was at 25, now it'll be going to 50%, up to a maximum of 10,000 people. Remember, it had been at 3,000 before, now it's going up to 10,000. Outdoor gatherings will be limited to 75% of rated occupancy. Those were at 50%, now they're going up to 75, again, not to exceed 10,000. Indoor and outdoor arenas include indoor-outdoor auctions, arenas, stadiums, tracks, fairgrounds, festivals, zoos, auditoriums, large event conference rooms, meeting halls, indoor theaters, libraries, swimming pools, or any other confined indoor or outdoor space. However, groups will still be no larger than 8 individuals, 6 feet separation between groups of groups. Still prohibited will be parades, carnivals, midways, dances, street dances, beer gardens, and so forth. Throughout Phase 3, those will still remain. However, parades where the patrons remain in their vehicles and the public does not line up along the streets will continue to be allowed. That'll still be okay. Dancing at events is permissible if the individuals remain at their tables and seats and keep social distancing between groups. So if you're at the concert, you can get up and dance in your seat, but you can't go anywhere to go do it. Dance recitals will be permitted, but again, must be following the other gathering requirements. Plans for reopening, again, just like we did in the past, if you're going to reopen or you're going to expand your capacity, you're going to have to submit that plan to your local public health department. If it's going to exceed 500 people, or in Douglas County, where you've got more than 500,000 people, it'll be 1,000 people. So if you are going to expand your capacity, if you've already submitted a plan and you're going to expand your capacity, you have to resubmit a plan for the expanded capacity to your local public health department and get that approved. Okay, so that's still part of what we have to do here as part of this. Gyms, fitness centers, health clubs, health spas will be limited to 75% of their occupancy rating. But again, 6 feet distance between machines, sanitizing everything, all that still applies. Salons, barbershops, massage therapy services, tattoo parlors, body art, limited to 75% of the rated occupancy. Again, both workers and patrons will have to wear a mask while they are being served, with the exception of when there's work on their face being done. You may recall we said there was an exception for estheticians. This is really being expanded. So, for example, your barber can give you a shave now, but your mask can only be down while you're getting that work on your face done. When you're done with that, you have to put the mask back on. Okay, so weddings, funerals, and so forth, those venues, maximum of 8 individuals in a party. Again, that's up from 6 where it was before. Self-serve buffets and salad bars are still prohibited. Venue staff must still serve. Limited dances and social events requiring guests to gather outside their respective tables will be in the guidance. And the distinction we're making here is that if you go to a wedding, generally there's a guest list. You know who people are. That's different from like a street dance where anybody can show up and you may have mixing of large groups of people that are not easily traceable afterwards. So at a wedding, we expect that contact tracers, should there be somebody who tests positive, will be able to get a guest list and do contact tracing more easily than at a street dance. That's why we're allowing dancing at a wedding venue versus a street dance where we're not. Starting June 22nd, let's see, all the counties that I said before, Hall, Merrick, Hamilton, and Dakota will be going into Phase 2, so those Phase 2 requirements will be similar to what it was before for everybody else. Now that's our Phase 3, again, that we're announcing today, starting June 22nd. We are also announcing today's Phase 4. Now, Phase 4 looks very similar to Phase 3, with the exception is that what I told you is all in the directed health measure, those DHMs. That means it's a misdemeanor violation to violate those. What we'll be doing in Phase 4 is, by and large, we're going to be taking all those things and moving them from the DHM into guidance in Phase 4. And the one exception to that will be gatherings. Gatherings for indoors will be limited to 75% of rated occupancy. Outdoor gatherings will go to 100% of rated occupancy. So again, in phase 3, they're at 50 and 75. In phase 4, for those gatherings, they'll go to 75 and 100%. Let's see. Gatherings include, but are not limited to, again, indoor-outdoor arenas, indoor-outdoor auctions, stadiums, tracks, fairgrounds, festivals, zoos, auditoriums, large event conference rooms, meetings, halls, indoor theaters, libraries, swimming pools, and other confined indoor and outdoor spaces. Again, we're going to be asking for 6 foot of separation and so forth. And your plans will still have to be submitted. If you're going to expand capacity in phase 4, your plans will still need to be submitted to your local public health department. And with regard to the timing of phase 4, we don't know that yet. So we're going to roll out phase 3 here, June 22nd. We're going to continue to monitor our hospital system, and we will make a determination at a later date when we will roll out phase 4. So what we hope is that we continue to remain stable as we go through the end of June and into July, and that sometime in July we can make an announcement when phase 4 would be able to start. So, but what we are doing is giving people the opportunity to look out ahead about what phase 3 is going to be June 22nd and what a potential phase 4 is going to look like at some point in the future, so you can start doing your planning. All right. Now, there's a couple other things we're going to talk about here: long-term care facilities and schools. We're going to start with long-term care facilities. Dr. Ashraf, who is with UNMC, who actually, you were here from the beginning for the ICAP program, right, Doctor? So you've been here 4.5 years or so? Yes. Around that? 4 years. Huh? 4 years. Oh, 4 years he's been here. So the ICAP program, or the Infection Control Assessment and Promotion Program, is a program that was funded from a CDC grant that came to the state of Nebraska that we use UNMC to be able to help work with our long-term care facilities over the course of the last 4 years to be able to help them with infection control. I believe that's one of the reasons why we've been successful here in Nebraska in working with those facilities and trying to limit some of the infections here in our state. So thank you very much, Dr. Ashraf, for all your work there. Part of what we're announcing today also is some of the phasing for those long-term care facilities to be able to get to the point, for example, where they could start allowing visitors for those residents. I've got Felicia Quintana Zinn, who's going to come up and talk to us. She's with our Nebraska Department of Health and Human Services. She is really our point person. She's done a fantastic job here at the state of Nebraska, working together with all the local public health departments, UNMC, all of our experts, working with my office. She's just done a wonderful, wonderful job in pulling all this together and keeping us all coordinated, not only on these guidance and DHMs, but all aspects of what we're doing around testing and contact tracing and quarantine, all of these plans we do for at-risk communities. All of that, Felicia has really been an integral part of. So Felicia, will you come up and walk us through what's going on with regard to the phasing for long-term care facilities?
Thank you. All right, good afternoon, everybody. So with regards to our long-term care facilities, throughout the COVID pandemic, really care for our residents in long-term care facilities is one of our top priorities at DHHS. And we've been really closely working with our facilities, with our local health departments and external partners, so that we can make sure to continue to provide some appropriate care for residents in their communities as they work through to maintain safe environments for their residents. So our role is really as a resource with the goal of helping to mitigate the spread of COVID. And what we've done is develop some phasing guidance for the long-term care facilities It's based on what was provided from the Centers for Medicare and Medicaid Services, and it's also based on best practice recommendations and evidence. So DHHS has developed this guidance for responsibly easing residents in the facilities while COVID still remains in communities across Nebraska. So the phasing guidance mirrors the directed health measure phases that we have here and that Governor Ricketts just talked about. So, but it really allows the facilities a standardized tool that can help them determine how they should ease the restrictions in their facilities based off of what's going on in their communities. So the phasing guidance is intended to be used by nursing homes and assisted living facilities in conjunction with the COVID resource planning tool that was released out, and as they plan for gradual return to standard practices in their facilities. So DHHS has received notification from a number of facilities that they've already completed their plans, and plans for the remaining long-term care facilities must be completed by June 22nd. So mitigation efforts have really been one of the key things that we've done to really make sure that those vulnerable populations in our long-term care facilities, we really try and make sure that they're limited exposure and try and help protect them as much as possible. So, but we understand at the same time that, yes, the virus is important in protecting them from that, but also it's equally important to consider their quality of life and the dignity of the residents that are in these facilities, and taking all that into account when it's time to begin relaxing restrictions. So the guidance that will be released out today provides information on easing restrictions while maintaining the safety of residents. It also includes information for baseline testing for facility staff and residents through Test Nebraska, which is funded through the state. And it can help facilities plan and prepare for managing COVID-19 in the coming weeks and months. So most importantly, it aids in the overall effort to combat COVID-19 here in Nebraska. So the guidance is in 3 phases, and it includes a variety of considerations for facilities like visitation, communal dining, and group activities. And additional considerations that are included in the guidance include screening for residents, staff, and other persons who enter the facility, the use of personal protective equipment, or PPE, you probably hear that quite a bit, how to cohort or group symptomatic or COVID positive residents in the facility. And each consideration has mitigation steps that can be implemented by the facilities to really find a balance for relaxing restrictions and maintaining enough of the precautions to keep the residents and their staff safe as well. So I'm going to go in short as to the 3 phases, just in summary, but there's more details in the plan that'll be released out today as well. So in short, all the facilities are currently in phase 1. So if their local health district is currently under DHM, or directed health measure, for phase 2, so pretty much everything in the blue, then they can actually start moving into the phase 2 of this guidance now. So they still have to meet some other criteria under the phasing guidance, but really they can start heading in that direction. In order to move to phase 3, the facility must be located in a local health district that is currently under these phase 3, so that actual blue, starting June 22nd. They must complete baseline testing on their staff and other criteria that are that are in the phasing guidance. So phase 1, limitations really affect visitation, activities within the facility, and restricts the non-essential personnel entry to the facility to really minimize the possible exposure for both the staff and for the residents. Phase 2 eases the facility and the resident restrictions. It allows for limited non-essential personnel entry and services like salons or cosmetologists to come in. And then phase 3, it further eases the facility and residents' restrictions, and it now allows for visitation outside of compassionate care situations, non-medically necessary trips, and it allows volunteers to start returning back to that facility. Facilities that are now allowed to progress to the next phase, they must, again, meet the requirements for relaxing restrictions and be in that equivalent directed health measure phase. So the facilities also really need to pay close attention to what's going on in their community and local community trends. So if there's a specific outbreak that's happening in their community or closely around it, they need to determine if really moving into that next phase is really appropriate for their facility and if that's in the best interest of their residents. So if there is a case of COVID-19 in either a resident or a staff in a facility, after they've progressed to another phase, like phase 2 or phase 3, the facility really needs to work with their local health department to determine if they need to move back to phase 1, so back to the very limited restrictions for everybody. So for baseline testing of staff and residents, DHHS really agrees with CMS that it's important for all long-term care facilities to participate in baseline testing before they relax restrictions. And baseline testing of all facility staff must be completed before the facility can move to phase 3. However, we do recommend that it is important to also test the residents, but it is not a requirement in order to move to phase 3. Staff and residents who decline testing should be treated as having a positive or unknown COVID status, and there is guidance in there on how to handle situations in which staff or residents choose to decline testing. Test Nebraska is being offered by the state to help facilitate baseline testing of staff and residents at no charge to the facilities for specimen collection, materials, laboratory testing, or PPE. If a facility chooses to use another testing service for baseline testing, they may do so, and it will still meet the baseline testing requirements. However, it won't be reimbursed by the state. And then information on the baseline testing through Test Nebraska is being communicated to all long-term care facilities in the state. And the facilities must register online, and the state will schedule the facilities for testing. We'll also distribute PPE and test kits to all of the facilities. So all test specimens are going to be processed through the CHI St. Elizabeth lab here in Lincoln, and the facilities and the local health departments will receive the test reports. So DHHS has really worked with our partner associations, the local health departments, to help facilitate feedback for the phasing guidance. And the phasing guidance is being emailed to all long-term care facilities in Nebraska today and will be available on our website later on. Thank you.
Great, thank you, Felicia. Now, I also mentioned that schools are a part of what we want to talk about. The schools are not in the DHMs, so the state is not putting anything with regard to schools in the DHMs for phase 3 or phase 4. Our expectation, my expectation, and the commissioner's expectation is that schools will be operating with kids in the classrooms this fall. And the commissioner is going to be working with schools to be able to make that happen. And so, Commissioner, will you please come up and talk to us a little bit more about that?
So thanks, Governor, and yeah, actually, I think folks should see this as a pretty substantial day. I think we've said several times, we hope that schools will have in-person learning. Our expectation is that they will have in-person learning this fall, and I think that's a great thing. And we want schools to be able to spend this time between now and the beginning of school really planning to figure out what are all the safe protocols that ought to be in place. The Department of Education will continue to provide guidance for schools, guidance that's really can be found at Launch Nebraska or www.launchne.com. This guidance really will be helping find the best practices that are taking place. Now, we've been fortunate to have a lot of conversations with school leaders all over the state talking about what really makes a safe environment. We've explored the CDC guidance, we've explored our own guidance, and are asking about what are the practical implications of each phase and each opportunity for guidance, right? That we're they're putting in place what's going to have to work locally. Now, we're going to provide this guidance, and we might say something in guidance that maybe doesn't seem practical for a given place, but it's actually balancing that, understanding what keeps people safe in an environment, what slows the spread of coronavirus is absolutely critical for these next steps. Now, our schools have been working, in some cases, our small schools have been working together as a group. Our schools in Lincoln, Lancaster County have been working together with local public health officials. Our schools in the metro area have worked together, putting their own sets of guidance documents together, and ultimately driving those set of local protocols based on their input. What we continue to do is look for best practices and be able to put those across the state and share that underneath Launch Nebraska as part of that particular effort. And I think ultimately in the end, it's finding those best set of practices that are going to work, making sure that we're finding ways that help remove the types of barriers that folks may see, and then really being cognizant of all those circumstances that might take place. I'm very pleased with how this is continuing to go. We've learned, I think when I said this summer was going to be a learning environment, we're continuing to use the summer activities as we kind of gradually re-enter into schools to put ourselves into a position to really understand what's best for students as we proceed. One thing the governor and I have talked about many, many times is really schools are built for students, right? That we intended that always have intended that we could get to a point where we're able to get students back in those settings. But there's the trade-offs, right? If we don't open schools, there's trade-offs for families, obviously from an income perspective, but also just from a socialization of our students, the importance of doing that. So finding that proper balance is really what we're asking local officials to be able to do, work together to ensure that we have those safe protocols in place. I think it's going to be a critical moment in time as we kind of go through these phases, really watching how individual behaviors start to change. And we want to make sure that we find ways to be able to do that really effectively with ultimately the purpose of getting our students back in school. I should say, I mean, with the dairy folks in the room, getting schools back in is also very good for students in the sense that they're able to get their regular school meals and opportunity to have those cartons of milk that we become so accustomed to in our school settings. But it's really that whole child need that we think is so important in schools, and finding this balance and doing this work as we continue is absolutely critical. So thanks to all the school leaders, superintendents, principals, others that continue to do this work. I know there's probably yet more questions to answer than we can probably put in place in one neat package, but the ultimate goal is getting students back in schools this fall, and that's our expectation as we turn that corner from phase 3 and even into phase 4. So thank you, Governor, for the opportunity to be here, and I'll step aside and let you wrap up.
All right, thank you very much, Commissioner Bloomstead. Again, just like hospitals where we're expecting them to manage it, same thing for our schools. The expectation is in-person learning, but we're expecting them to manage it, that it won't look like it did a year ago. Is that safe to say, Commissioner? Safe to say it's not going to look like it did a year ago. We are expecting our schools to figure out how to be able to make this happen, but I got to tell you, based upon the leadership we have in our schools and the way that they responded so quickly to the beginning of this pandemic, I'm confident that the Commissioner and his team, working together with our superintendents, will be able to figure this all out and have kids back in the classrooms. So thank you, Commissioner, appreciate it. And again, it's important to remind everybody that as we go through loosening some of these restrictions that we've just talked about, that we continue to practice social distancing. That 6-foot distance, wear a mask when you go to the store, wash your hands, avoid large groups. Continue to do that. That's how we slow the spread of the virus. We will continue to monitor our hospitalization capacity. We can expect that there's going to be more cases, folks. We're going to continue to test. We're going to continue to test through Test Nebraska. We just had these protests where, again, people were in large groups. This is how the virus spreads. We saw that in our National Guard. So we expect that we're going to get more cases in part because of the large gatherings that occurred with the protests. So we want to continue to manage this. We have to manage it for the long term. This is part of our steps to allow people to start returning to a more normal life. So Taylor, we didn't have anything written down here for questions. Do you have questions that were texted in?
Yeah, Kristen with KPTM wants to know if you can clarify the rules for bars in Douglas County. Are people allowed to set up bar shops?
Kristen in KPTM wants to know if clarify the rules for bars in Douglas County. Can they set up bar tops? The answer is yes. And under phase 3, they will be able to consume food at those bar tops as well. So all the other rules will be applying, but no food right now. Starting June 22nd, yes to food.
Becca with NEC has a couple of questions. One is, have groups other than Test Nebraska been reducing the number of tests they've been doing, and do we know why if that's the case?
Becca, NETV wants to know, have groups other than Test Nebraska been reducing the amount of testing they've been doing, and if so, why? And the answer is yes. Providers, for example, have been doing less testing, even as Test Nebraska has been doing more testing. And I imagine it's just if you look at the number of cases we have and our hospitalizations, we're just seeing fewer of those. And so I imagine it's tied to fewer people coming in with the symptoms or the exposures that they think that they have coronavirus, and so there's just fewer tests being done.
She also wants to know, since Test Nebraska will have verified testing information on long-term care facilities, do we expect to start reporting facility-specific information on coronavirus for those facilities?
So Becca wants to know, also, since Test Nebraska is going to be doing testing on long-term care facilities, will we start releasing testing information on long-term care facilities, and that is not part of the plan right now.
The Dakota County Star says that some local officials don't want to follow the state's eligibility guidelines for CARES Act money, and wonders if you have any comment on that.
So the Dakota County Star says some local officials don't want to follow the guidelines with regard to eligibility for CARES Act money. And do I have any comment on that? And it really is, it's their option. If they don't want to follow the guidelines, they won't be eligible for the CARES Act money, but that's certainly their, prerogative to do that.
That's all I got for now.
All right, that's all we got for now. So, questions from folks in here? I know we covered a lot. Paul?
Can you clarify the rules on restaurants? Is there still gonna be a 6-foot distance when you get to 100%?
So the question was from Paul, clarifying rules on restaurants. Will there still be a 6-foot distance between tables when we go to 100% occupancy? Yes, that will be in the guidance, though. It will not be in the DHM. It will not be the violation of the, a misdemeanor violation. But yes, that will be in the guidance document for those restaurants.
Those guidance, you're not sure when that's gonna take effect.
So the guidance documents that we will put out in conjunction with the DHMs. So again, what we're doing, a lot of times what we're doing, Paul, is taking things out of the DHM where it's a violation of law and putting it into the guidance as we loosen these restrictions. We still think it's a good idea. We're just not making it a misdemeanor violation.
So I gotta ask the football question.
Football question, okay.
At 100%, doesn't that open the door to having a full stadium at Memorial?
So the question was, if you go to 100% occupancy for outdoor venues, doesn't that open it up to a full football stadium? Maximum 10,000 capacity, so no, it would not be a full football stadium at this point. However, even with this, we're still expecting venues to manage this around social distancing, and they still have to go to their local public health director and get a plan signed off on before they can actually be in operation. So so this is not actually a green light for a full football stadium at Memorial Stadium yet. We all hope we can get to a football season, but this is not it right now.
And can you just comment overall on why you're doing this now? I mean, there was some concern that Memorial Weekend, we're gonna see a spike of people getting together. What are you seeing? Why relax these DHMs?
So Paul's question is why relax the DHMs, and basically because the data supports it. So our public dashboard, go take a look at it. If you go look, for example, at our case data, you'll see it. It's a nice bell curve, and we're on the downhill slide. If you go look at the hospital tab, you'll see the same thing with regard to hospitalizations, a nice curve going down. We probably have got the fewest amount of hospitalizations statewide that we've had since the first week of May. So again, the data shows that we can start loosening these restrictions. And again, we want to continue to monitor this, but that's why we're making the decision to go forward with the announcement for June 22nd. All right, Paul, I'm cutting you off because we got to go to somebody else. We'll come back to you if we run out of questions. Brandon?
Just for clarification, so it was 10 people at one point, then it was 25, and is now, there's no number as long as you're within that occupancy percentage? Is that?
Yeah, so Brendan's question was, it was 10 people, then it was 25 people, now it's occupancy ratings. Yes, that's correct. So there is no 10-person rule starting, 25-person rule starting June 22nd. It will all relate back to occupancy ratings for those venues.
Bill
Right.
Shammer wants to know, there were several rules in place about dugout distancing, bleachers, snacks, regarding sports. Do those still apply in phase 3?
So Bill Shammer wants to know about the rules with regard to dugouts, concessions, snacks. Felicia, we're moving that all into guidance, is that correct?
Well, it's already in guidance.
It's already in guidance and it remains in guidance.
Yep, and we'll make some small adjustments.
And there'll be some small adjustments to that. So I'd refer you to the guidance document comes out, but that'll still be in the guidance documents.
Steve White wants to know, the Central District is seeing 5 or fewer new cases a day. If that continues, how quickly can Grand Island go to phase 3?
So Steve White with NTV wants to know, with Central District being at single digits, like 5 or fewer for the last couple of weeks, how quickly can they catch up with the rest of the state? I continue to have conversations with Mayor Steele and Teresa Anderson about this. We just talked Friday, for example, and we'll continue to work with the local public health department and Mayor Steele with regard to when they feel like we can move that on. But it's an ongoing conversation. Fred?
What's the soonest families can visit their relatives in a nursing home, and do the nursing home residents and staff have to be tested?
So the question was, when's the soonest a family member will be able to visit their loved one in a nursing home facility, and do the staff and the residents have to be tested? To move into phase 3, the staff have to be tested. We're recommending that the residents be tested. And Felicia, I'm going to have you come up and answer the first part of that question and just give a little bit more detail about when someone can expect to be able to visit a loved one in a long-term care facility.
Hi, so really it's going to depend on where that facility is located, and if they've had, they've completed the testing and the different criteria. But as long as their local health district is in phase 3, so starting June 22nd would be the earliest, and then they've had the testing for all their staff has been completed. They're not really seeing any positives, things like that. And they have a couple other criteria that have been met, then they can start reopening for visitation for their family members.
And the residents don't have to be tested?
Residents are not required to be tested. It's recommended, but really, they don't have to be tested. So we want to keep kind of keep that open for facilities and kind of what's in the best interest of their residents.
Just for clarity, Felicia, you want to talk about what happens if somebody does test positive in one of those facilities, either staff or resident?
Yeah, so if somebody does test positive, whether it's a staff member or a resident, then they'll work with the local health department, and likely the ICAP team will also come in and kind of help assess where they're at. We'll work on the contact tracing and then determine if additional testing is needed at the facility, and just if, depending on the situation, the exposure level, all of those different things, then it may be determined that they have to go back to phase 1, which means no visitors, or they could stay at their current phase if they're able to meet isolation requirements.
So is phase 2 what they're in now, and that's only in dire circumstances?
Yeah, so it's compassionate care, or if there's psychosocial, like if it's in the best interest of the patient's mental health for visitation.
That's phase 2 where most of the state is right now.
Yep.
And who determines that?
The facility, and in the best interest of the patient. They know their patients, they know their residents, and what's in their best interest.
Thank you, Felicia. Yeah, Lee.
Just kind of following up on Paul's question. In regards to why now, you mentioned that the hospital data is representing that this is the optimal time. Why is it now, not the end of the month when we see the restrictions on phase 2 was supposed to expire? Why only 14, 15 days after the first or the second DHM went in place?
Yeah, so typically, again, what we've been using is using that kind of 2-week time frame to kind of measure when new cases and new hospitalizations are coming along. That's what we kind of did through all the month of May. And so this is what we're doing in June as well. And so we loosened restrictions June 1st. It's June 15th now. We're actually making the announcement for June 22nd, so it'll be actually 3 weeks. So we're taking this a step at a time based upon the incubation period for the virus. And if we don't see, again, a lot more activity, which we actually have seen declining activity, we feel comfortable with loosening up those restrictions another step.
You've kept Douglas County within phase 3. Is the hospital data supporting the Douglas County also going into phase 3?
So the question was, is the hospital data also supporting Douglas County going to phase 3? And the answer is yes. I believe today, as of today, we had about 97 people in Douglas County hospitals. If you go back and look, a couple of weeks ago, it was like 130 some people in the hospital in Douglas County. So they've also been on the downward swing. Yeah.
I know you look at hospital data for like determining who goes in phase 2, who goes in phase 3, but have you considered all having hundreds, if not thousands of people together, when they're out protesting the last couple of weeks?
So the question was, what about the protesters? There were thousands of people protesting. did that play into your consideration? We believe that we've got the testing capacity to be able to test folks. And again, the whole way this generally works in epidemiology is that you test to find the person who's infected, you get them isolated, keep them away from the rest of the public so they don't infect anybody else, and then you do the contact tracing to be able to go out and find the folks who were in touch with that infected person and get them to quarantine or monitor their symptoms if it wasn't a close contact. And so we've got the ability to be able to do that now through things like Test Nebraska. We have over 750 contact tracers now trained to be able to get on top of anything and do robust contact tracing. So we've got the resources to be able to do that. So we are obviously going to continue to monitor this very closely with regard to what happened with the protests. It is a cause for concern, but we feel that we've got the capacity to be able to handle it.
Dakota County Star has a follow-up question. They want to, it is similar to the first one, but they want to know why we're requiring counties like Dakota County that have a high rate of coronavirus results to reopen or not receive federal funding.
So Dakota County Star wants to know, why is Dakota County required to take some of the steps we've asked for example, make sure your county courthouse is open to serve the public when they've had a lot of cases. And actually, if you go back and look over the last several weeks, Dakota County has been in single digit, sometimes 0 cases on a daily basis. So really, we aren't seeing more cases in Dakota County.
We also have a request from Becca at NET to get an update from Dr. Anton on the number of long-term care and meat processing cases.
Dr. Anton, can you come up and share with us the numbers on long-term care and food processing, please?
I'll start with long-term care numbers for today. There have been 131 long-term care facilities with either a positive staff member or resident affected by COVID-19. There's 560 residents that are COVID positive in those facilities, and 451 staff members. Deaths are at 99 now, with 1 still pending validation. So those are the long-term care facilities.
Do you have the data for the last 2 weeks?
I do. So the governor's asking, and we are keeping track now for the last 2 weeks. I think the most glaring thing is that we have not had a validated death in the last 2 weeks in any of the long-term care facilities. And we've had 39 residents test positive in the last 2 weeks, with 14 facilities either having a staff member or a resident test positive. So I think it's getting somewhat better as far as long-term care facilities are concerned. Before I leave long-term care facilities, I do want to also thank Dr. Ashraf, who's sitting in the audience today, for all his help. I don't know how we'd be as good as we are, as well as we're doing. The governor mentioned last week that Nebraska ranks 11th best in the country as far as the number of residents in long-term care facilities per 1,000 residents testing positive. And we rank 13th best in the United States as far as long-term care facility deaths per 1,000 residents. So again, it's all due to, again, Felicia also and all the team we have. I mean, we don't like to see anything happen in long-term care facilities, but it just gives you an idea about where we stand from a national standpoint. The meat processing plants haven't really changed a whole lot since we reported it last week. We have 4,071 confirmed cases of workers in the meat packing industry and 15 deaths and 173 hospitalizations in the meat processing plants. Again, the governor was mentioning about Dakota, Grand Island, Lexington area. It seems like once that area gets over the initial phase, the initial surge, they've really settled down quite quickly. And as a matter of fact, Grand Island Hospital today, St. Francis, again, which used to report up to 30, 40, even up to 50 positive cases, is down to 4 cases now, with only 1 of those cases in the ICU and nobody even on a ventilator anymore. So fairly good numbers overall.
Thank you, Dr. Anton. And that, just that point, yeah, single digits or 0 in many of those counties where we had the food processing plants, Saline, Colfax, Platte, Dakota, Adams, Dodge, or not Dodge. Dodge has been low double digits, but pretty close. Yeah. So the things we laid out there are, for phase 3, are in the DHM with the guidance for some things like the 6-foot distancing between tables. And then the plan is, broadly speaking, to move that in phase 4 from the DHM into guidance. So yes, that's broadly speaking. The one exception to that is gatherings. Indoor gatherings are going from 25 to 50% in phase 3, and outdoor gatherings are going up to 75% in phase 3. In phase 4, indoor gatherings will go to 75%, outdoor gatherings will go to 100%. Yeah, Brandon.
So on the handout, it says the contact team sports are allowed July 1st, just from my understanding, so that's football, soccer, wrestling.
Right.
And
So starting July 1st, contact sports, football, basketball, all those contact sports will be allowed to have games and practices starting July 1st. The decision was, again, just taking a look at loosening restrictions a step at a time. We had prohibited those in the month of June. We're allowing them now in the month of July.
Beckett MET wants to know, Dakota and Hall counties have slowed the spread enough to reopen their courthouses. Why are they not moving to phase 3 now?
So Becca wants to know if, if they've slowed in, say, Central District Public Health in Dakota, if they slowed enough to single digits, which they have, why aren't they moving just straight into phase 3 again? We're taking this a step at a time. So it's a step at a time for everybody. It's going to be a step at a time for the Central District, Hall County, Dakota County. Other questions? Paul?
Just to clarify, on the nursing homes, do they have to test before they can move to open visitation, or do they have to have a plan to test?
So the question is, they actually have to test. The staff, this complete testing for staff to be able to move into phase 3 and allow those visitations.
Can you give me an update? You said, you got the capacity to test now. What is Test Nebraska doing per day now?
I don't have the numbers. We've got, on Test Nebraska right offhand, I don't know if Dr. Antone has, we've got the capacity. When we're in Omaha and Lincoln, Paul, we've got the scheduled slots for 3,000 tests a day, and we've got the lab capacity to do over 3,000 tests a day. Now, obviously, this week, I announced all those other cities. When we're in our small rural towns, we're not going to get to that same kind of capacity just because there's just fewer people. But when we're in Omaha and Lincoln, we can do 3,000 tests a day.
How many days have you done 3,000 tests a day?
Have we hit 3,000 tests a day yet? I know we've had the scheduled slots.
2,400 something was, I think, the
I
largest.
think the largest so far has been 2,400.
Last week, the average was 1,625 per day.
The average last week was 1,625 per day. And again, this is why we need people to get signed up. And one of the issues we run into also is when we sign up people for Test Nebraska, we've got scheduling slots. We found, I think, about a 15% rate of people not showing up. So that also takes us down. We don't want to promise a slot to somebody who doesn't show up, but then we have people who don't show up.
And time for a couple last questions.
Can you comment on this New Yorker story that came out this week? It was a long story, but one of the issues that was raised was the use of the extractor that's being used is normally used for plants and animals, not for humans. But that coupled with the level detection could explain why they have much lower positivity rates with these Test Nebraska programs.
So the question was about a New Yorker story. I have not read that story, Paul, but here's the deal. We have a CLIA approved lab that has verified the equipment. University of Nebraska has verified the equipment with us. We validated it. We're quite confident in our results.
Last question.
What is the positivity rate now?
Positivity rate for Test Nebraska, a little over 4%?
Right at 4%.
Right at 4%.
How's that compared to the other labs?
How does that compare to the other labs that are people coming into the hospital who we know are sick? How does that compare?
Public health lab always has a little bit higher positivity rate, closer to maybe 9 to 10%.
Okay.
Overall, statewide, we've been below 10% for the last several weeks.
Yeah, I was going to say, so statewide, broadly speaking, we've been below 10% for the last couple of weeks. Nebraska Public Health Lab is closer to 9% public testing. Yeah.
11, 12%.
Yeah.
So basically, you don't have any concerns about
I do,
positivity rates?
I do not have any concerns about low positivity rates with Test Nebraska.
Media went through the lab a couple weeks ago when Paul was out.
Oh, media went through the lab a couple weeks ago when you weren't here, Paul. So, all right. Any other last minute questions? Seeing none, thank you again, folks, for coming here to be able to get the update. We've got a lot of news here today. I know it was a lot to digest. Mike, thanks for coming here for Dairy Month. And appreciate Felicia, you, and the commissioner coming to talk about what we're doing with regard to long-term care facilities in schools. Folks, again, please remember to continue to do social distancing so that we continue to slow the spread in our state and continue to loosen restrictions. Thank you all very much, and have a great day.